Hi, I'm Dr. John Gall, one of the doctors at ERA Health. I'm often asked by my male patients what's involved in an STI screen. In other words, a screen for sexually transmitted infections or diseases. It's a fairly simple screen and one that we undertake on a very regular basis within the clinic, particularly as we're one of the few clinics in Victoria that undertake HIV Rapid Testing, where we can give you results within a matter of 30 minutes of your attending the clinic. Anyway, back to the STI screens. Firstly, before I go into all the details about it, I'd like to point out that should you come to the clinic and have such a screen, be assured that the entire consultation is absolutely confidential. This is something that worries a number of our patients, that the information will somehow be obtained by some agency or individual. It won't. If you want the information to stay within the clinic, that is precisely where it will stay. Well, what's involved in an STI screen? The main infections that we're looking for are infections caused by chlamydia, gonorrhea, syphilis and HIV. There are a variety of others such as hepatitis and some of the more unusual infections that mostly viruses that may be also transmitted, but we won't worry about those at the moment. We'll concentrate more on the major infections that tend to affect the population. When you come to us requesting an STI screen, we're going to take a history from you so that we can be sure that we test the right areas and test for the correct things. Now, I know talking about sex when it's a very personal matter can be somewhat daunting for some. Please feel free to speak freely to us about your encounters. We've heard enormous numbers of stories about what has happened. We are not surprised by what happened, and we're certainly not judgmental about what may or may not have occurred. What we're there for is to help you and to ensure that your health is uppermost and is paramount generally. So apart from the history, which is very important, and it's really important to be upfront and honest with us, we'll then arrange for the appropriate testing, and usually this includes collection of urine sample, maybe a swab from your throat, from your anus, and a blood test. And the blood test is usually to test for syphilis and HIV and maybe hepatitis. If you have symptoms, and the symptoms generally will be pain when urinating, or a pain in your penis generally, or discharge from your penis, and maybe even pain within your testicles, then you should come and see us as soon as possible. But if you don't have any symptoms and you're worried about some sexual contact that you've had, it's probably best to leave it until about 4 to 6 weeks post that contact, unless you're likely to infect somebody else, in which case you need to come sooner. But if you can leave it to that time, then that's great, because then we can do most of the testing at that point. At 4 weeks, generally we can test, or before the 4 weeks, if you're likely to have picked up chlamydia or gonorrhea, we can usually detect that within a matter of days following your contact. If it's something such as syphilis, we usually need a period of 4 weeks before we can do the test. We can also test for HIV at that time, although you need to understand that sometimes some people don't show up as being positive for HIV until after 3 months, or up to 3 months after their contact with somebody who had HIV. And the same applies with hepatitis. Again, be assured that everything you tell us in the consultation is confidential, and If you've got any questions regarding this, please feel free to contact us. You can leave a comment below, or if you're wanting to provide more personal information and would like a direct answer to you, please send me an email at info@erahealth.com.au. Thanks.